60-year-old plumber who had severe confusion, mood changes, memory impairment, and sporadic jerky movements became completely dependent on a caretaker and died a few days later. He was completely healthy 5 months ago. The brain biopsy showed widespread atrophy of the cerebral cortex and cerebellum. What accumulation is most likely to be observed in histologic analysis of the patient's brain tissue? Now, there are some couple key findings that we need to be aware of. The first one is that this patient was completely healthy 5 months ago, so he had rapid degeneration. Another important finding we need to be aware of is myoclonus. So this patient had involuntary jerky sudden movements. And third is that the patient experienced widespread atrophy of the brain that included the cerebellum. Now remember, neurodegenerative diseases are usually going to leave the cerebellum alone, so this is an important finding. Now, all of these findings are going to be characteristic of Creutzfeldt-Jakob disease, which is a prion disease. Now, prion protein is usually going to be in the alpha helix conformation, and the disease is going to occur when this alpha helix conformation is changed to beta pleated sheets. And so the beta sheet conformation is going to induce other proteins to change conformation, and it is going to be resistant to proteases. And so it is going to keep on accumulating within the brain, and it is going to be highly neurotoxic. So it is so neurotoxic that it literally creates these holes within the brain tissue itself. So that is why it is called a spongiform encephalopathy, because it literally makes the brain look like a sponge after it creates holes in the brain tissue. So the answer to the question is going to be answer choice D, protease resistant protein. This is going to be the hallmark of prion disease. We're going to have accumulation of beta sheets, which are going to be resistant to proteases, and it is going to keep on accumulating within the brain tissue, and it is going to create holes within the brain, resulting in spongiform encephalopathy.